We're here at the Royal Society of Medicine for a launch of a new product, Zinopin, which could prove to be a dramatic breakthrough in the prevention of deep vein thrombosis. Dr. Scurr, can you tell us how it feels to develop deep vein thrombosis?
A deep vein thrombosis is a blood clot. It occurs in the deep veins in the leg. The first thing that happens is it starts in the lower part of the leg. You may get some pain and discomfort, but as the clot grows, you will get swelling of the leg. And then as the clot grows right up into the top of the leg, the swelling becomes more pronounced, the pain becomes more pronounced, the leg will feel heavy.
Are there always obvious symptoms?
There aren't always obvious symptoms to this condition, and often it's completely silent. You can have quite a big blood clot without knowing anything about it at all.
Would I need immediate medical attention if I had such a condition?
A blood clot in the leg isn't too serious. It takes quite a long time, often several days, before it is big enough to break off and go to the lung. So yes, you do need medical attention, but it's not something that has to be done instantly. What we tell people to do is go to the doctor, make the diagnosis and get treatment as soon as is reasonably possible.
Can you tell me why I would be more at risk from deep vein thrombosis if I was flying?
People who fly sit still for long periods of time, and it's the sitting still, the immobility, which is one of the most important risk factors for developing a blood clot.
Are smokers more at risk?
Smoking is interesting. There have been a couple of studies which suggest smokers have a lower risk of getting blood clots than people who don't smoke. We don't really know the answer to that question.
What exactly is Zinopin, and how does it prevent thrombosis?
Zinopin is a mixture of pycnogenol and ginger, and what it does is it reduces some of the factors which are known to predispose to deep vein thrombosis. It reduces venous stasis, it reduces swelling in the leg, it reduces the stickiness of the blood.
Aspirin has been previously recommended for this condition. How is Zinopin different?
Aspirin has been recommended, but the problem with aspirin is that some people bleed quite seriously with it. The difference between aspirin and Zinopin is that you don't have any of the bleeding side effects with Zinopin. It's safer.
Why would I be better off taking Zinopin than any other medication before travelling?
Zinopin is not only effective, it's very convenient. You can wear things like elastic stockings, you can give yourself injections of heparin, but they're more difficult. Stockings, for example, you've got to be measured for. If you're not measured for them, they don't fit, then they don't work. Injections are painful, difficult carrying needles through security. A simple tablet is very effective, very simple.
Lastly, can you give us any other advice for travellers as to what they should take as well as Zinopin when travelling?
Travelling is very safe. For most people, there aren't any problems. If you've had previous problems, if you've got recent illnesses, go and talk to a doctor and he'll advise you properly. For the majority of passengers, there is no real risk, but if you take something like Zinopin, you can reduce the risk of the not so rare, but not so common either, blood clot that occurs unexpectedly during travel. That's why it's important to take something like Zinopin.
Dr. Scurr, thank you very much.